good afternoon, everybody. It's great to see everybody here in the room. And we don't see the people online, but I know they're there behind that screen. But it's a thrill to welcome you to today's Dean's Lecture. And as you know, this is a chance for us to hear from newly appointed and promoted professors, as well as senior scientists here at the school. And it's always a special treat when one of our promoted, newly appointed or promoted faculty are actually an alum of the school. And that is the case today with Shannon Doocy. Shannon first came to the Bloomberg School intending to pursue an MSPH, and then things happened, and soon she decided to switch from the MSPH program to a PhD program. And at the time, she had just moved into an old row home in South Baltimore. And like so many of our local row homes, it was equal parts charm and structural failings. I think we've all been there. But Shannon was undaunted and quickly learned how to make repairs and become an adept at renovating these old homes. And for anybody who's in need, I'm told that if anybody's in need of advice on old pipes or faulty wiring, Shannon's your person. She has a wealth of useful tips for stabilizing old houses. Now, you might say, well, why am I beginning there? You know, what am I, this is an unusual introduction for a Dean's Lecture. But I share this story today because it tells you some important things about Shannon. First of all, she's a problem solver, and she's not afraid of a challenge. And finally, she's always ready and eager to share her deep knowledge and bright ideas with others, including plumbing and electrical work. These traits are on display every day in Shannon's incredible work here at the Bloomberg School. Shannon is the current director of the Health Systems Program in our Department of International Health, and she is a core member of the faculty of the Center for Humanitarian Health. She studies the health impacts of humanitarian emergencies and works to find the best interventions for people affected by natural disasters and conflict. She is internationally recognized for her work, particularly in the area of cash transfers and food security and nutrition. Through her research, Shannon has helped to put a spotlight on the public health crisis in Venezuela. She's allowed us to better understand acute malnutrition in children in Pakistan, and she's shown how the conflict in Iraq has affected the country's health services. And these are, of course, just a few examples of the work that she does. Shannon has more than 20 years of experience working with governments, universities, and international NGOs to bring public health intervention to some of the most vulnerable people in the world. Her efforts in helping to improve the health and well-being of communities that have been torn apart by war, weather, and other disasters. And I'm sure you can imagine humanitarian, and I know a number of you are in the audience, work in the area of humanitarian health, and it's a tough space to work in. The job often requires swift response to sudden crises, and Shannon is quick to bring the work of public health where it's most needed. At the same time, she is always working toward the longer-term objective of expanding the evidence base to improve humanitarian policy and practice. And in pursuit of these goals, Shannon travels to difficult areas, asking hard and important questions. How can we improve food security in places where millions are hungry? How can we use cash transfers to effectively help families in conflict zones? The problems before us are great, but solutions are in our reach, and Shannon is helping us find them. She has a passion for data and analysis, and she's always busy measuring, analyzing, and innovating. She has pushed the field forward, not only in her own work, but through her encouragement and support of the next generation of leaders. Shannon excels at teaching and administrating academic programs and has deep expertise in the training and capacity development of global health professionals. She's known for inspiring her students to follow their passions. Certainly, this is a time when we desperately need more champions in humanitarian health. As many of you know, it's estimated that in 2024 alone, nearly 300 million people around the world will need assistance and protection because of conflicts, climate change, as well as other disasters. Public health needs to step up, and I know Shannon is ready for the task. She has the will, she has the tools, and she is ready to work toward real and lasting change. Professor Doocy, we are so grateful for all you have done and continue to do for the Bloomberg School and for public health, and we're so excited to hear from you today. Shannon?
Well, thank you very much, Dean McKenzie. And I also just want to extend my immense gratitude to all of the mentors that I have had during my journey here at Hopkins, in particular, Dr. Burnham, who's been my academic advisor and informal mentor from the day I set foot in this building, and many others in the department. Today, I want to share with you a current example of one of the projects that I'm working on right now that I think is really emblematic of the challenges that we see in terms of moving public health practice forward, and how can we use research to change the systems that are responding to emergencies worldwide. So I want to start with just a general overview of what are the human impacts of natural disasters, and how do we expect these to change as we know that climate is impacting many of our lives in different ways? And then I'm going to introduce you to a new approach to humanitarian response, which is called anticipatory action. And anticipatory action aims to respond to risk before the event, not waiting for the crisis to occur. And in addition, it's really aiming to build response capacity, which is something that we need desperately to work on in lower middle income countries where the impacts of natural disasters are the greatest. And finally, we're going to take a slightly deeper dive into anticipatory action in Fiji and how this may or may not work for responding to tropical cyclones, which are going to be of growing importance as we see the climate shift. So to start with an overview of natural disasters. Natural disasters in the first 20 years of this century claimed over 1 million lives, affected 4 billion people, and led to $3 trillion in economic losses. And you can see, if you compare the first 20 years of this century to the preceding 20 years, the impact has grown by every single measure. And unfortunately, this is a trend that we can expect to continue. When you take a deeper dive into what types of natural disasters are most frequent and most impactful, you can see that floods and storms are definitely the most common. But when you look at the rate of growth, and in particular focus on climate-related disasters, you can see that these are growing faster than many of the others. So floods, storms, droughts, heat waves, and wildfires are all falling under the umbrella of climate-related disasters. And there's been a near doubling of these events in a 20-year period. And we know from recent experience just in the past couple of years, and if we think about Helene and Milton just in the past few weeks, that these events are not only becoming more frequent, but they're becoming more intense and having more extreme impacts. So what are the impacts on human populations of climate disasters? So we can see in the first 20 years of this century, there's approximately 25,000 deaths annually, which overall is relatively modest. But these are only direct deaths. This doesn't include indirect mortality. So the child that didn't have clean drinking water and died of diarrhea, or the expecting mother who couldn't make it to the health facility and died, those numbers are not counted here. And we know the system's impacts and the disruptions of these events are enormous. So while we see that early warning has been really successful in reducing the impacts of some natural disasters, we know that these mortality estimates are significant underestimates of the true costs. Next, I want to draw your attention to the affected population, and notice the difference in scale here. So this is the affected population each year in millions. So when you look at floods alone, 80 million people affected a year, storms, 40 million, and these numbers are expected to increase. So This is really, really substantial when you think about the loss of education, the loss of livelihoods, the loss of access to health services, right? Many of these impacts are years long if you're in a really devastated community. And then we also tend to look very often at economic losses. And here you can see the economic losses are immense as well, and also really projected to increase as the intensity of these events get greater. And so what I would like you to kind of take away from this is that, one, we're not very good at measuring the impacts of these events because these are the best measures that are consistently collected globally. And that's about all we have. We don't really have that deep understanding of systems impacts and the more nuanced understanding of how individual families and communities are affected at a broader scale. We do know for sure that certain types of events cause more mortality, more economic losses, and tend to affect more populations, and that these patterns are really changing. And here I'd really like to highlight the storms category, because storms are among the top three for both mortality, affected populations, and economic losses. So there's something that we really need to focus on in particular, because these are one of the important climate disasters that are going to be increasing in the future. And so when we talk about storms, in practice, we're really talking about tropical cyclones. These comprise the vast majority of all of the impacts in the storm category. And generally, when we talk about both storms and tropical cyclones, we see that the human impacts, so mortality, affected populations, are really concentrated in Asia. And that's because there's a large population concentration there, it's a large landmass, and just geographically, that's where they tend to occur. Now, tropical cyclones are also known as typhoons and hurricanes. It just depends on your geographic location. And there's an average about 35 tropical cyclones each year. And when you look at where they impact, we all know the East Coast of North America and the Caribbean is the main area that we pay attention to, but also Southeast Asia and Madagascar are also highly at risk. And what is projected to occur in the future is that we're going to see more high intensity storms. And so we've seen just in the past few weeks what that has done here in the United States. But you can imagine if you are in a lower middle income country and you don't have the resources to respond, that the outcomes are going to be potentially much worse. So thinking through a little bit about climate change and tropical cyclones, what can we expect to see? What's going to change in the future? Well, first of all, we're going to see more rainfall and more inland flooding. So the projections suggest on average a 10 to 15% increase in rainfall, but also much more intense storms, right? So just recently, looking at our history here, Hurricane Harvey, 60 plus inches of rain in the most affected areas. Can you imagine 5 feet of rain? And, when you look at the rainfall totals here, this is just in a couple of years that we've seen these. And this is projected to get worse. Sea level rise and storm surge are another main area of concern. So since 1900, sea level rise is estimated at about 0.5 foot. By the end of this century, there's going to be an additional 1 to 2.5 feet in sea level rise. So the vulnerability of coastal communities to storm surge is going to increase substantially, right? So in storm surge is the water being really pushed into the inland areas. So imagine if you're combining that now with the increased intensity of rainfall, there's really nowhere to go. So if you think about Hurricane Helene, that storm was 400 miles wide, a little bit more, right? So imagine the intensity of that with all of that rainfall. And if the storm surge had hit in a different area in Tampa, that would have been devastating. And so really, I think what most people are feeling is the impacts of these storms are coming. And it's just a question of when, but it's going to get much worse. The only bright spot in this is that the overall frequency of storms may actually decrease, but the less bright spot is that the proportion and number of storms that are going to reach that intensity, that 4 and 5 level kind of scale of a hurricane, is going to be higher. So while there is a small bright spot, we're not going to dodge the bullet. And the aim of these storms is going to widen. So areas that have not previously experienced these storms are going to experience them. They're going to be less prepared. And we're going to see new and different types of impacts. So nobody really predicted that North Carolina was going to be vulnerable to a hurricane, right? That's not normal. But maybe that's our new normal. And if you look at how flood maps are drawn based on historical risk. Only very new flood map products are taking into account the projected change. And when you see the difference in magnitude of the population that's at risk, it's enormous. But there's a lot of political motivations to not acknowledge that. So moving from an understanding of risk to acting on risk is really a large challenge. And the community impacts that we're going to see, in particular in these lower middle income settings where there's fewer resources to dedicate to preparedness, are going to be immense. So by 2050, estimates are that the climate crisis could cause nearly 15 million extra deaths, $12 trillion in economic losses, and an additional $1 trillion in costs for healthcare systems globally. So these are huge numbers. And the question is, systemically, what are we doing to change how we respond? And we know that there's a mix of factors that are in play here, right? And we can't change the increasing intensity of climate-related events that are coming. Or maybe we can, but like that ship has already sailed, right? The climate crisis is here. So really now we're looking at what are these drivers of risk? And there's a lot of them: poverty, population growth, urbanization, more and more now conflict in failed states where you're seeing the layering of natural hazards on areas already affected by conflict. And how can we really understand risk better in this new context and manage it? And so anticipatory action is a relatively new development in the humanitarian space that really aims to reduce disaster losses and facilitate recovery faster, but also this really important systems component of building capacity and collaboration for disaster preparedness and response. Because you can imagine that if you're in a resource-constrained setting, it's a hard sell to invest in preparedness when you don't know if or when an event is coming. There are many more immediate pressing needs that your constituents are going to want you to address. So anticipatory action is really aiming to not only improve governance and commitment to disaster response in these most affected areas, but also to improve how we do it and to change the humanitarian system and make it a more risk-based response instead of a slower reactive response. So when we think about traditional humanitarian response, what does it look like? Well, we wait for a crisis, we do a needs assessment, we plan how many people do we need to reach, what do they need, and then there's that process of funding allocation and mobilization. But this takes time, it takes a lot of time. And so the idea of anticipatory action is to act ahead of the hazard. And this requires a lot of investment and planning. But the idea is if you had pre-agreed upon triggers, then pre-agreed upon activities and funding that was released immediately, you could respond in this small early window ahead of the event. And the assertion of anticipatory action is that it's actually going to reduce the impact of the disaster because people have the ability to reduce their losses ahead of time. So from the humanitarian response perspective, this has the potential to be very beneficial because then we get to spend less on recovery and there's fewer needs after an event, right? The challenge is that this time window is pretty short and there is a lot of investment that has to go in to all of this pre-agreement. But the concept that you really could act ahead of a risk and in response to a risk, and speed the response is really attractive, right? So for anticipatory action to work, you're spending probably, at least in the case of Fiji, it was a year or more of getting governments and UN agencies to have all of this pre-agreement. So a lot of time and investment. But the idea is, if you're responding to risk and ahead of the event, you can really reduce the impact. So for example, if I know that a cyclone is coming and I'm able to push out cash transfers, maybe households can buy what they need to evacuate. They can sell or move their grains or their crops. People can take action on early warning messages that are much better crafted and well instructed, right? And so all of this comes together in theory to reduce impact. The challenge is that no one has actually been able to measure this impact yet. And so that's what our job is, to come up with a creative way to measure the impact of anticipatory action in an actual emergency when nobody wants to collect data and when the activities really should be focusing on the response and not data collection. And this is a recurrent theme in humanitarian settings. What is the best quality evidence that you can convince your humanitarian partners to collect while not overburdening them? And it's an interesting challenge. So when we kind of think about anticipatory action then, in this kind of broader continuum of what we would think of as disaster response, there's preparedness, which can go on for months or years. Anticipatory action, which has this long contingency planning stage, but a very short implementation phase. But I also want you to be clear that it also kind of extends into the disaster response or early response and recovery phase. So some of the interventions will be started before the event, others will continue after, but it's still an early and quick foot in the ground in affected communities. So anticipatory action sort of started in its earliest forms about 10 years ago, I would say, in just with single agencies in single sectors. And since then, it's gained a lot of momentum. It's really evolved to the point that it has now been taken up by the UN Office for Coordination of Humanitarian Affairs, which manages and coordinates all international humanitarian response as part of their current plan. So they have piloted anticipatory action in different places. They are now scaling it, and they've committed a fair amount of funding to it through the Central Emergency Response Fund. And so we're seeing the scaling of these responses, but we actually don't really have a lot of evidence yet as to how effective they are. And so when I say scaling, this is the current OCHA-facilitated anticipatory action portfolio. And you can see there's different types of disasters that are included, and these are very specific to each country. So each country will select disasters that they are most at risk for, that they feel they need the support to respond to the most. And some of these are activated. They've actually rolled them out. Others are endorsed, meaning the framework is there in the event that an activation occurs, the response will occur. And then there's others that are still in development. So what I want to focus on is the tropical cyclone framework for Fiji. And this came about probably several years ago now and was at least 18 months in the development stage. And it involves a lot of negotiation with the lead disaster response agency in Fiji, which is the National Disaster Management Office, and then a lot of other ministries which partner with various UN agencies. And so what I'm going to walk you through is, what does anticipatory action look like in Fiji? And what are some of the issues in designing an evaluation? And let me just say, it's been a journey, because with like 8 UN partners and a similar number of government agencies, that's a lot of input to take in and get consensus on. But I think we're getting there. So for anticipatory action triggers, generally, you want a trigger to be something that can be reliable, timely. Ideally, it's very automatic. It's a forecast that some agency that everyone agrees upon puts out on a very regular basis. And so in the case of Fiji, the triggers and there's two. There's a readiness trigger and an activation trigger are based on the cyclone forecast, as you would expect. So in this case, a readiness trigger comes a little bit earlier than the activation trigger, but it also comes with slightly more uncertainty. So if there's a category 4 or 5 storm that is projected to be within 250 kilometers of Fiji, that's the readiness trigger, meaning funding would be released and agencies could start preparing. The activation trigger is at 72 hours if there's a category 3 or 4 or 5 storm that's projected to make landfall. And so what you can see is for the readiness trigger, the average lead time is 87 hours. That is not very long to roll out a humanitarian response, is it? So one of my big questions for anticipatory action is scaling these interventions in such a short time window feasible? And then you get to the activation trigger, that's 70 hours. And so that's when it makes landfall. But can you imagine distributing aid right before it makes landfall? Because you're still experiencing pretty strong hurricane force winds, risks of floods, all sorts of these things. And then think about this in the context of Fiji, where you probably have to reach half of these islands on a boat. Do you want to be out there? No. So there's so many process questions about how this will work and how can it be done better and how do you coordinate that are really interesting, but they're not questions that can be ignored because disaster response in Fiji has to happen. So we have to figure out how to do it better. So on average, historically, when you look back at the data, we will reach this trigger in Fiji almost every 3 years, slightly less than every 3 years. So we know these storms are coming. So then the next question is, okay, we have our trigger. What are we going to do when we respond? And so when you think about how you select activities for an anticipatory action response, feasibility is king, right? It has to be something that can be done in a very short time period. And in theory, in a way that you can get supplies to communities ahead, right? Or to pre-positioned locations. So timing is really key. And then also when you think about what interventions you want to deploy, you're looking for interventions that are tried and tested in other locations, right? You don't want to try anything new because we know that what works everywhere only sometimes works in humanitarian settings. So we're not looking for anything special and shiny. It's really just going to be what is basic life-saving assistance that we can provide in an immediate lead up to and a kind of aftermath of this type of event. And then for these multi-sectoral responses, and Fiji is one of the first countries where we're having a multi-sectoral response with so many different UN agencies involved, it's also really looking at how do we coordinate and are the activities that are proposed kind of within the mandates of certain organizations and their expertise. So for Fiji, and the tropical cyclone pilot, they are hoping to reach 70,000 people with early warning messaging, multi-purpose cash transfers for almost 50,000 people, tarps, water sanitation kits, dignity kits, shelter kits, agricultural inputs to help secure boats and store key items. And so you can see this is a whole long list that is going to be delivered by various UN agencies and their partner ministries, and in some cases, NGOs. What's really critical about this, and we'll get to funding in a minute, is that there's been a lot of effort and time, but also pre-investment by these agencies in stocking supplies. So for funding this response, the funding is coming from the UN Central Emergency Response Fund. And this came about a couple decades ago, and it was really an idea to increase equity in humanitarian response, because very often the most visible crises get the most money, and those that are not in the media attention have less funding. And so this centralized fund allows everyone to kind of evaluate need and allocate funds more evenly globally. So there's fewer kind of crises that are completely overlooked. And so this will be the funding mechanism for Fiji, along with co-funding from these different organizations. And the idea really then of anticipatory action is to move from this bottom of the period, which is our traditional humanitarian response, where an emergency occurs and then we respond, to a more forward-thinking approach, where this prearranged financing comes with pre-agreement on activities and a whole rollout plan so that we're responding right away. So for Fiji, there's around $2 million from the UN SURF Fund that is guaranteed to be paid out at least once every 2 years. And then the partner agencies are co-financing. And so there has to be a big commitment up front from partner agencies, because if you want to provide shelter kits or education kits or health facilities with supplies, all of that has to be procured and stocked in country ahead of the tropical cyclone season, right? And what we know about the SURF funds is that they cannot be used ahead of this activation trigger. So this is another really big challenge to scaling anticipatory action, is that if the funds are released so immediately before the event, well, where does all of that kind of pre-financing and pre-commitment before the big fund release come from, right? And so fortunately, many of the UN agencies have been really kind of bought into the idea of anticipatory action and are investing in it. But I do think for other kind of scenarios, this could be a potential barrier. So for example, if governments want to do this, are they really going to be able to invest? So just to give you an example of how anticipatory action will change tropical cyclone response in Fiji, this is the timeline for Cyclone Nyasa, which was a Category 5 storm that hit Fiji in 2020. And so the storm hit on December 17th, and you can see that the disbursement of funding was 53 days later, right? So that included the needs assessment, the initial request, a revised request, but it was 53 days until FAO, the Food and Agriculture Organization, could roll out their response. So the idea with anticipatory action and having this framework is in place is that had that happened, the readiness trigger would have been reached on December 13th, 4 days before the onset of the storm. And the activation trigger would have been reached 2 days later. So the funds would have been released before the event. And ultimately, it's a 57-day difference in the timeline of response for UN agencies, right? So that's really significant when you think about what these communities are experiencing, right? And so our goal is really in this Fiji pilot to understand what does and doesn't work in this context, because I think that there's going to be a lot of challenges. There's not going to be a lot that just doesn't work because of the timing and the logistics. So really then, how for the next time can we make it work better? And how can we build the evidence base that actually shows what the outcomes and impact of anticipatory action is? So that question of, does anticipatory action actually reduce the impact of disasters? Are households able to cope better, make better decisions, and have resources that can enable better choices pre-event to reduce their risk, right? So the goal here really is not only to learn about anticipatory action and cyclones in Fiji, but also to think about how this can expand and influence more multi-sectoral evaluations in the Asia-Pacific region, and ultimately to build the evidence base so that donors can decide, is anticipatory action worth funding? Because we actually don't know that yet. It's rolling out, but we haven't seen that it reduces the impact as one might expect across multiple settings. And we know that for anything to really be adopted at scale, it needs to be replicable and work in multiple places. So for our kind of role in this, Hopkins is the learning partner for this pilot, and we have been tasked with developing an evaluation plan, including the methods and data collection tools, so that when the Fiji anticipatory cyclone activation occurs, that evaluation is ready to go and it rolls out right in step with the whole activation process. So we've spent the past 5 months or so talking to different UN partners and government agencies, and we're in the final stages of kind of getting input on this design, and we are going to have it ready for the cyclone season. And so the first stage was really kind of trying to understand, what do they want to learn? What is important to understand in this pilot? And we identified kind of process learning questions, which are really aimed at understanding where are the weak spots and how can we make them better. So how did coordination work? How did identification of households and communities work? This is one of the hardest things that I find in humanitarian response that we don't talk about, because nobody likes to talk about it, is how do you choose who's most vulnerable, right? That's really hard, especially if you only have 3 days. So how was that done? And did supplies make it? If they didn't make it, well, why? Because we need to know that so that we can improve the response next time. And then also, really importantly, how did anticipatory action complement other ongoing activities for preparedness and response? Because we don't want to take away from anything that's already ongoing. So these are kind of an examples of the process learning questions about how did it go and how can we do this better next time? And then the more challenging part was, well, what about outcomes? So were the early warning messages, did they reach people? Were they effective? Did people take action based on those messages? And how are these interventions sort of scaled up, right? Because within that 3-day window, considering all of the logistical nightmares that you face with a tropical cyclone coming, is it really possible to deliver at scale? And if we did deliver, which we'll see, then what was effective? And so we're going to be looking at what's effective in terms of each of the different UN agencies' sort of standard indicators, but also taking kind of a more holistic view, looking at protection of households, empowerment and decision-making, and more importantly, sort of resumption of normalcy after the event. And so there's a lot of issues with research post-emergency. And this is always what makes me most nervous when I talk to a Hopkins crowd. When I talk to the NGO people, they're like, oh, you want to collect too much data and you're too rigorous. And then you come here to Hopkins where people have like longitudinal cohorts for 20 years and randomized controlled trials with tens of thousands of people. And there's just no way I ever get to do that. So I wanted to have everyone understand, what kinds of issues do you face in a humanitarian setting? Why can't we design those studies that we want to design? And so when you think about study design, you want to be able to show causality, to attribute the change that you see to an intervention. Well, in humanitarian settings, you almost never have that comparison group. I cannot go out and say, well, we're just not going to provide assistance in this community over here because I have a research question, right? That's totally unethical. And we can't randomize assistance after an event. Also unethical. So that, I would say, is one really consistent challenge that you see again and again in humanitarian settings. How do you design an evaluation if you don't have a good comparison group? Another challenge that we face here in Fiji is there's no good option for a baseline, right? So very often we like to have a baseline and an end line, and we like to compare change over time. Well, when do you conduct that baseline for a cyclone? We came up with a few options, but none of them are good options. So we could conduct a baseline at the beginning of every cyclone season, or perhaps every few years. But that's a pretty costly undertaking. And remember, we don't have any funds for anticipatory action until the event occurs. And when you think about all of the competing priorities, probably a national baseline for anticipatory action is like the bottom of everybody's list. Not a great thing to propose. Another idea would be to do an activation survey. So when you know that cyclone is coming, could you go out and survey those households that are most likely to be in the path? And that's a good idea until you think about the logistics, right? So questionable to send a team of interviewers out into a tropical storm strength kind of wins and deteriorating conditions just ahead of an event, right? We also don't necessarily know who's going to receive these interventions. So even if we got there, we wouldn't know who to talk to. And because some of these organizations haven't pre-identified specific individuals yet, right? Another big challenge is, well, okay, maybe we could do this via phone if we had some phone lists. Except Fiji has black spots where there's just no phone coverage, and we know that phone coverage isn't going to get any better ahead of a storm, right? And we also know all of the inherent issues with phone surveys and bias in terms of who has phones. So this is a big challenge. No baseline data, no comparison group. We also have interventions that are delivered at lots of different levels. So usually when you evaluate an intervention, you're evaluating an intervention. But here we're evaluating like a good 10 or 12 interventions. Some are targeted at individuals. Some are targeted at the household level. Others are community level interventions where the community is going to decide who's most in need or who should benefit, and there's going to be no record of that. And others are facility level. So they might target a health facility. They might be establishing a safe schooling location or an evacuation center. So we're looking at so many different levels. What's a good study design where you can capture these all? It's a tough question. And then we also have this issue of the variation in the scale and targeting approach of interventions. So some of those interventions will reach several hundred households, others targeting 70,000 individuals. So if you think about this from like a survey or sampling perspective, how do you make sure that you get a good enough sample size to evaluate each intervention, right? So if I go out and I conduct a survey in an affected community, and there's a total of 50,000 people that received a cash transfer, I will definitely find some of them. But if there's only 400 or 500 that received a shelter kit or that received boat securing materials, the likelihood that I'm going to encounter some of them is much lower. And I'm definitely not going to get an adequate sample size that I need statistically for analysis. So that's a problem. And then another problem is that the way the interventions have been designed, some organizations, like the Food and Agriculture Organization, which is providing livelihoods protection, and International Organization for Migration, which is doing shelter strengthening, they've pre-selected what they call the most vulnerable communities. And that's where they plan to work, though they don't know who within those communities they're going to target. Other organizations like World Food Program are using what's called dynamic targeting, where they're working with their ministry partners, their government ministry partners, and they have pre-identified lists. So who are the most vulnerable households? And they're going to push out cash transfers to those most vulnerable households. And we have a phone number, but we actually don't know exactly where they are. But the challenge is that there's these different approaches. So I can't go out and do a phone survey of FAO and IOM's people because we don't even know who they are yet. Potentially, I could survey the WFP folks by phone, but then they don't overlap necessarily with all of the other interventions. So there's a lot of issues with study design. And so how did we decide to do this? What we landed on was a four-pronged approach. So first, a community-level survey to assess coverage of interventions. And here we are going to add questions to the initial disaster assessment that's done by the National Disaster Management Office that focuses very broadly at a community level on which interventions were received. So this will give us an idea of exposure. And the benefit of this is this survey happens within the first week or two after an event. And this isn't really a time where it's appropriate to propose your own independent data collection. So the strategy of piggybacking is really important because we really shouldn't be spending separate resources just for research at this point. So the idea here is to add questions into this initial disaster assessment, which would include all affected communities. So we'll really get a good idea of, well, what was the coverage and scope of each of these different types of interventions at a community level? And then following that, at 1 month post-event, which was collectively kind of considered to be the earliest time that was appropriate to do data collection, we will go in and do a household survey. And here we're going to do a household survey focusing on 2 types of communities. First, those pre-identified communities where FAO and IOM and other organizations are going to be working, where there's arguably going to be a stronger response. And second, not pre-selected communities, which will certainly have some activities, but not the same scope. And so the idea is that we'll have this stratified design so we can do this comparison, and a very modular approach to the survey. So if someone says they received an intervention, then we're going to do a deep dive on that intervention. And the idea really is then to be able to compare those that did and didn't receive a certain intervention, and also those that received, like many interventions, to look at how their outcomes differed. And really, we're going to be looking not only at those sector-specific indicators, but those broader questions of, did people have agency to act before the event? Were they able to experience fewer losses and return to normalcy sooner? And then additionally, because we have interventions delivered at so many different levels, we're going to do structured observations at health facilities, learning spaces that are supported by UNICEF, and also specific infrastructure that was targeted by the response. So for example, if you were able to secure your boat, how did it fare compared to people that didn't get a boat kit? Same thing for shelters. And then we're going to do a lot of qualitative data collection, focusing both on what was the community's perception of the response and how can it be improved in the future, and also from the government, ministry, and UN agency perspective. How did that planning process go? How did the implementation process go? And what can we do better? And then finally, because you never want to collect more data than you have to, we're going to be trying to pull in all of the M&E data from the UN agencies that are implementing. And so we'll be incorporating that. And the hope is, in addition to kind of avoiding redundancy, that we're really increasing the ownership of this evaluation. Because you can imagine with UN agencies, and so many of them all together, and the government agencies as well, that there's a little bit of tension here and there between who is doing what, who got how many resources. And so by pulling them all together, I think really this is going to allow them to demonstrate their overall contributions to the response. So this was kind of the strategy that we've come up with for addressing all of the shortcomings that occur when you are trying to evaluate programs in humanitarian settings. And so right now we're in a feedback stage, and we are in the process of sort of finalizing all of the details for the evaluation approach. And then we're going to get ethical approval for the protocol, both in Fiji and here, ahead of the tropical cyclone season, so that this was all ready to go. And we are also in process of identifying a local data partner, right? So that the tools will be ready, the training will be ready, and the local data collectors will be all ready to go at the same time the anticipatory action response rolls out. And so now it's just going to be a wait and see game. And I'll be hoping to keep you posted as to if the response is successful and achieves all of the outcomes that people are hoping it will. So thank you.
Well, thanks so much. That was fascinating and incredibly timely when you think about it. I guess we're going to entertain some questions. And for those of you online, if you have a question, you can either raise your hand, your visible hand, or just type in the chat, and Becky Newcomer, and I will call on you if you have a question. But maybe I can start. You're sitting here, and given the events of the last couple of weeks, you've got to ask the question: is there any discussion about using anticipatory action here in the U.S. in advance of disasters like hurricanes?
I think the U.S. response is really strong in terms of early kind of preparedness and pre-positioning of supplies, even though they don't necessarily go out to households kind of right away. I think one of the big differences is the fact that we're a high-income country.
Yeah.
And so we manage these responses pretty much on our own. And that's kind of the expectation of most countries, is that for natural disaster responses, where there's that capacity, they should be managed independently. Where you're seeing more of this kind of anticipatory action is really in lower middle income settings, where there's that need for government response kind of capacity building and preparedness, but also that need for external resources.
Sure.
So while I think it would be great to implement here, I think our response systems are generally much stronger.
Much better, but
and so
not perfect.
Perhaps there's slightly less need.
Sure.
Yeah.
Sure. Understood. Questions? Yes.
This is Islam Ahmed. From the MPH.
Hold on. We're going to get you a microphone. There you go.
This is Islam Ahmed from the MPH program. Thank you very much. I was working in UNICEF Sudan in the humanitarian response up until June, so I understand, I can relate to this. But I was wondering, where did the need for the anticipatory approach come from? Is it that there is like a failure in the preparedness, or the preparedness were felt like they were not adequate enough to support the response? And my second question is on the data collection for the anticipatory action. I'm not sure if when is that going to take place, given that the cyclone is approaching. The data collectors might be concerned for their own safety. Yeah. So how did you manage that? Thank you.
So I think for anticipatory action, this has come about from seeing that responses in general are slow and often inadequate. And I should say the humanitarian needs have doubled in the past decade, right? We've seen this immense doubling of need, but a system that can't keep up, right? So there's just no way we're going to meet those needs. And so there's definitely a push generally to see how can we reduce impact, but also in many settings, there isn't enough emphasis on preparedness. And that, I think, in my view, is a lot due to resources, right? Resource limitations. It's just so hard to dedicate money to preparedness when you have all of these other immediate and pressing needs. And so the benefit of at least the UN-supported anticipatory action is it's bringing external resources to countries and building the government response capacity and sort of coordination and preparedness mechanisms all at the same time. So it really, in my view, it should be an addition to our preparedness and response activities and sort of a new way of thinking. It's not going to replace any of them. It's just one more little piece of the puzzle that might make things better. And in terms of data collection in Fiji, so we completely scrapped the idea that you could get data on the ground before the event. Because doing a real good, robust survey is just too costly in the face of so many competing priorities. And going out right before the event, when you actually know where the impacts are going to be the greatest, is just not feasible or responsible in terms of putting interviewers at risk, but also kind of just thinking about all of the challenges. Even if you plan that, doesn't feel likely we could execute it. So part of the reason for kind of embedding our first round of data collection in this planned initial disaster assessment that's conducted by the government of Fiji is that's really the first real opportunity to get on the ground. And that will happen anyway. So if we could do a light touch and just piggyback a few questions into that, that's where we're going to get our initial information, and also where recall is going to be the best. One of the things that I worry about asking questions a month after the disaster has occurred, which is when the first time we're really able to do good primary data collection, is that people's recollections of anticipatory action are going to get all mixed up with their feelings of the response. And we really are going to try and isolate that. So this is kind of a classic example of research in a humanitarian setting where it's not how you would design it if you had the choice, but this is the best that you can do given the setting.
We have several questions in Zoom. We can start with one at least from Astha Ramaya. I'm not sure if I'm pronouncing it correctly, but they say, thank you so much for your insightful lecture. I was wondering if you have thought about different types of disasters such as war and famine and the applicability and anticipatory action in those situations.
Sure. So I think for droughts, we see anticipatory action as in place and potentially something that's a lot easier to manage because the lead up window is actually months instead of days. For famines and food insecurity, we have a great system in place where we can see risks and where food insecurity is deteriorating. And there, the question is really, do we act on that soon enough to provide assistance? So I think there are really good examples for food insecurity and natural disasters where anticipatory action can work. For conflict, I think it's much, much harder. But I would say stay tuned because the Center for Humanitarian Health is working towards how you can kind of project out potential conflict risk, how that overlays with other kind of risks of governance and natural disasters. So there is a lot of work in that space, but my feeling is that because that's a new space and anticipatory action is a new space, let's try and figure out anticipatory action for natural disasters before we add in all of the uncertainty of conflict. But I think it's really important that we eventually bring it to conflict because when you look at where humanitarian response dollars are spent, it's definitely more in conflict settings. And we definitely are anticipating an increase in the overlay of conflict and natural disasters.
Is there a question? Yeah.
Thank you so much. I had a question more about like partnerships. It seemed like the UN was kind of taking the lead for a lot of those activities. What is really the role of those community organizations within that affected country within anticipatory action?
So I would say the role of community organizations in anticipatory action is really varied. So you will see like here, there were a lot of different UN agencies listed, but some of them will have local partner organizations or be working with ministries. So for example, like the Fiji Red Cross is a key implementing partner for FAO and IOM in this case. In other anticipatory action evaluations that I've worked on, they're working with local community-based organizations. So the way like the funding mechanism works for UN funds is the UN funds only go to UN agencies, but then they pass through to local partners and in many cases governments. So even though it looks like it's a very UN only response, there's definitely partnerships that are occurring within each of the national response frameworks. And the idea really is to build that national capacity with the long-term goal being to completely transition and have stronger government-led response.
Go ahead. Yeah, we'll take another question online.
Thank you for this talk. It was really, really interesting. Kind of piggybacking off what you just said, I'm curious what you think about the, not necessarily competing priorities, but looking at how these NGOs and organizations should prioritize anticipatory action compared to capacity building. Because I feel like a lot of the challenges that you brought up in the study design, many times organizations are looking to address those in the form of capacity building. So I'm curious what you think about how those two, both trying to address the same problems in different ways, might have conflict, and how you would address that, or what should be prioritized.
So I think what was interesting in having all of these stakeholder meetings was that anticipatory action was really seen as capacity building, and there was so much effort in planning and thinking through what was an appropriate response and how exactly things were going to be delivered and when you were going to procure and pre-position, that might not have happened without this kind of multi-partner anticipatory action approach. So I actually viewed it as very complementary for capacity building. And what surprised me was the government's real concern that if anticipatory action was elevated too much, it would take away from typical preparedness activities. And that was something I wouldn't have expected, because to me, preparedness is such a long-term kind of project. It's never ending almost. And anticipatory action seems so kind of concise and finite. But that planning phase of anticipatory action was, stretching into the years. And so it was a really good opportunity for capacity building and dialogue.
Take a question online.
This is from Nikita Deshpande. Thank you for such an interesting talk. I'm curious if there are simulation-based models being developed to help overcome the challenge of not having a control group when you conduct research.
That is a really interesting question. I think it would be great to develop the simulation-based models. It's also something that is a little bit beyond my expertise. And so I love to have good colleagues that are modelers, but I haven't necessarily seen modeling of the impacts of kind of these types of interventions, because I think before you can successfully model, you need good data to put into your models. And we actually don't really have good data yet as to if these interventions are as impactful as we hope. And even if we were able to, even if the interventions were impactful, I think there's that question of, can we deliver them within that window? So I think it would be something that would be great in the future, but I think we need more actual data on the effectiveness of an anticipatory action before we can sort of model and see how it might work in other scenarios.
One more question. Okay, this is from, I'm sorry, it's a little bit long. Nabila Perno, thank you for this great lecture. I work with UNFPA, Bangladesh, and have worked directly with the AA for, bear with me, I'm sorry, floods. Ground realities are too complex for traditional research approaches or even effective response. A lot of focus needs to be on capacity.
Understand in the process, how can it be done better next time?
Okay, and we can send you any other questions that are in the Zoom chat for
Sounds good.
you to respond to by email.
Great. Well, again, thanks so much. Great lecture. We're all looking forward to the results of the evaluation. Now, I don't know if that means we're looking forward to a cyclone in Fiji, but let's hope. Your evaluation works if it happens. Let's put it that way.
Let's hope the response works.
The response
And the
works.
evaluation.
Yes, of course. All right. Well, thank you again and congratulations. And we would welcome everybody to join us for a reception around the corner. Around that corner at the Wall of Wonder. But thank you all for coming.
Thank you.
Recording stopped.